Today we are going to see a very common problem in growing toenail. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, a health related explanation is provided via a video which is released every week. If you want to see such videos, subscribe to this channel. Also press the bell icon adjacent to it to get instant notifications whenever new videos are released. This week's video is about ingrowing toenails. As I have shown in the photograph above, ingrowing toenail is a very common problem where the sides or the corner of the nail is growing into the skin. As it buries into the skin, it creates problems. The nail should normally grow outwards. Instead, if it grows into the skin sideways, it is called as ingrowing toenail. What are the causes for ingrowing toenail? The most common cause is abnormal clipping or abnormal cutting of nails. Now, for aesthetic reasons, what we generally do is we cut the nails angularly. We create edges on the lateral side, on the borders, and these edges grow into the skin. So if we cut just straight across, leaving the edges as it is, it may not look pleasing, but this will reduce the problem of ingrowing toenails. The second common cause is injuries to the nail. Other causes could be a tight footwear or wearing heels, improper foot hygiene. Some families genetically have this problem. So this problem can also run genetically. Some professions do have a high risk because they are always constantly exercising with their foot, like footballers or kickboxers or ballet dancers. So all these people can have ingrowing toenails. What happens when the toenail grows into the skin? Most commonly this happens in the greater toe. What happens is, as it buries into the skin, it creates pain, swelling, redness. It is very tender to touch, and if there is bacterial infection, then it creates pus, fever, even more swelling. And as it grows often again and again, the skin adjacent to it becomes thicker and harder. Because of the infection, you can also have bleeding from the site. How to prevent and treat this problem? As I have already said in the initial part of the video, this clipping of nails angularly into the corners needs to be avoided. Nails should be clipped or cut straight across, so leaving the edges intact so that they don't grow into the skin. Especially those people who have had this problem once should follow this regularly so that it doesn't happen again. Hygiene of the toes is important, so you need to regularly wash them, but you need to keep the toenails dry, so it can't be soaked. If you already have developed ingrowing toenails, what can be done? You can soak your feet in warm water for 15 to 20 minutes at least twice a day regularly. This can revert this. You can add Epsom salt into the warm water, or you can use plain warm water as such. But we have to ensure that after keeping the foot in the warm water, once we remove it, we need to keep it dry. You can't have the feet and the nails and the nail borders wet, where we can allow the bacteria to grow, so it can become worse. If you have pain, you can take simple analgesics like paracetamol. If you have pus or signs of infection, simple antibiotic ointments like Neosporin might help. But if the swelling is more, if the pain is very severe, if there is pus oozing out or bleeding, you need to visit the doctor, who may give antibiotics if the infection is very severe. They may do partial nail clipping or a complete nail removal, depending upon how severe the infection and how severe the ingrowing toenail is. You can have recurrence of this problem, especially if you have a partial nail removal, your nail hygiene is not proper, this may recur again. This becomes especially a problem in diabetics. So diabetics have a higher risk of infections, especially in feet, and if there is an ingrowing toenail and if it is left untreated may lead to disastrous consequences. So if you are a diabetic and you also have an ingrowing toenail, visit a doctor, preferably a surgeon, immediately. One word of caution regarding the treatment of ingrowing toenails is, so you may do home remedies like soaking your feet in the warm water or taking some local antibiotic creams, but what should not be tried is bathroom surgery, meaning where you do the nail removal by yourself, leading to severe infections or bleeding from such processes. So these misadventures should be avoided. Get consulted with the proper qualified doctor and get treated. This was a short explanation on ingrowing toenails. If you like this video, share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again. Bye.